So in this session we'll be dealing with the gross features of the liver. You can see here the thumb is in the inferior vena cava or groove for inferior vena cava, and the four fingers are covering the anterior and right lateral surfaces. As you see here, this is the falciform ligament. This is the falciform ligament which is attached to the anterior surface of the liver. So onto the left of it will be the left lobe, onto the right of it will be the right lobe, and this sharp margin will be the inferior border. This is how you will be holding the liver in anatomical position, by keeping the thumb in the inferior vena cava or groove for inferior vena cava, and these four fingers will be in relation to the anterior and right lateral surfaces. Now let us go with further discussion. So हाथ निकालो. So now what you are seeing is this is the anterior surface, this will be the superior surface, this will be the right lateral surface. How I identified the anterior surface is with this, the attachment of the falciform ligament. So this falciform ligament divides the liver into anatomical right lobe and anatomical left lobe. And if you see physiological lobes, physiological lobe will be divided by the groove for inferior vena cava and fossa for gallbladder. Both when we join, that divides the liver into a physiological right lobe and physiological left lobe. So anatomical right and left lobes are divided by the falciform ligament, whereas physiological left and right lobes will be divided by a plane passing through the groove for inferior vena cava and the fossa for gallbladder. So this will be the anterior surface. You can see this is the superior surface and this will be the right lateral surface. इस तरफ घुमाओ. So now you can see here, this is the posterior surface you are seeing. So this entire thing is the posterior surface. If you see, this will be the posterior superior border which separates posterior surface from the superior surface, and this will be the posterior inferior border which separates posterior surface from the inferior surface. This inferior surface, otherwise called as visceral surface, the posterior surface, superior surface, anterior surface and right lateral surface, all together called as the parietal surface. So if you have been asked, you can tell the liver is having two surfaces, parietal surface and visceral surface. The visceral surface is the inferior surface, and the parietal surface is divided into posterior surface, superior surface, right lateral surface and anterior surface, where we have seen the falciform ligament. So now the borders are, you can see this is the sharp inferior border which is clearly defined. So this sharp inferior border separates the inferior surface from the anterior surface and the right lateral surface. And you can clearly see this arbitrary posterior inferior border separates the posterior surface from the inferior surface, and this posterior superior border separates the posterior surface from the superior surface. And clearly we will see the features on the posterior surface. So this is the left lobe of liver. You can see this is the fissure for ligamentum venosum, and this is the caudate lobe, and this is the inferior vena cava which is lying in the groove for inferior vena cava. And this is, you see this is the rough area, this is the bare area of liver. Wherever it is lined by peritoneum, it is smooth, and this is the bare area of liver. If you see the boundaries of bare area of liver, so this will be the apex of bare area of liver where right triangular ligament will be present. So that will be found by joining of the inferior layer and superior layer of the coronary ligaments, and the base of the bare area is found by the inferior vena cava or groove for inferior vena cava. So I'll repeat again, this is the left lobe of liver, this is the fissure for ligamentum venosum, this is the caudate lobe of liver, this will be the inferior vena cava and the groove for inferior vena cava, and this is the bare area of liver bounded above by the superior layer of coronary ligament, below by the inferior layer of coronary ligament, apex is by the right triangular ligament, and base is by the groove for inferior vena cava and inferior vena cava. And here you can see this is the porta hepatis. This is the porta hepatis, and if you see here, this fissure for ligamentum venosum and porta hepatis, this is the line of attachment of the lesser omentum, and below you can see this is the inferior surface. So this is the inferior surface of left lobe of liver. This is the fissure for ligamentum teres hepatis. This will be the quadrate lobe. This will be the quadrate lobe, and this is the gallbladder in the fossa for gallbladder. And now if you observe, so physiological right and left lobes are divided by a plane passing through the groove for inferior vena cava and the groove for fossa for gallbladder. So this line will divide the liver into a physiological right lobe and a physiological left lobe, whereas falciform ligament will divide the liver into anatomical right and left lobes. Thank you.